Before we catch up with Naples businessman Craig Bouchard, who has a book on the New York Times bestseller list, The Caterpillar Way, we meet our guest succeeds an icon at David Lawrence Center, the Center for Mental Health Services in Southwest Florida. It's based in Naples, and he is from Arlington Heights, where he was the manager of a mental health hospital for a healthcare system in that Chicago suburb. We welcome Scott Burgess. Welcome to Naples.
Thank you so much. It's a gorgeous community, gorgeous weather. Certainly by way of comparison with Chicagoland, this is just a paradise.
You follow a guy who casts tall shadows. Dave Schimmel. Yeah. I mean, the impact that he made on healthcare, specifically mental health in Southwest Florida, is hard to overestimate.
Yeah. I've not met with Dave personally, but we've talked on the phone, and just from everything that I'm hearing from the community members that have partnered with him for such a long while, the organizations, the police department, and so many different organizations, as well as the staff, they sing his praises so loud.
He was hands-on. He led by example. Yeah. He was the real deal.
Yeah, absolutely.
Now let me ask you to move on. Now you're from the Chicago area. You've had a chance to size up the status of healthcare services in Southwest Florida. Mm-hmm. Do we have what we need?
We have a lot of what we need, but there's a lot more that still needs to grow. For example, and that's nationally as well. Southwest Florida is very consistent with the trends that we're seeing across the nation in several different ways. Number one, child and adolescent services. We know that according to the President's New Freedom Commission on mental health that started under George W. Bush, carried through with President Obama, that there's probably 3 to 4 children in every American classroom that struggles with some sort of social emotional issue, and 50 to 70% of those kids are not receiving any care whatsoever from a mental health professional. So we know, just like any other medical condition, that the earlier you identify an issue, the earlier you treat an issue, the better the long and the short-term prognosis is. So that's an area I think that as I'm assessing the terrain here that I'm seeing is consistent with national issues that are out there. And there's several others. Integrated care is another area. Integrated care meaning that for a long while in healthcare we've treated the body and then we've treated the mind. And they've been kind of parallel systems, but not necessarily working well together. And what we're seeing is individuals with serious mental illness, things like schizophrenia, things like severe bipolar disorder, are dying 25 years younger than the general population. So we know that their health care is not well attended to, and we know that that's something that we need to better address. Conversely, we know that a lot of the primary care physicians are prescribing medicines now, psychiatric medicines, and that's something that we think that there'd be a lot of benefit if we could partner together.
Education.
Education, correct.
Are you also concerned about the size of some of these prescriptions? I mean, they're huge.
Yeah.
And then the unused pills can sit around and get into the wrong hands.
Yes. There's a national issue out there with prescription drug abuse for some of the things like benzodiazepines or other types of things that can be addictive. So that's certainly something that we need to get our pulse on and make sure that we're addressing. In addition to accurate prescribing, we know that sometimes that when there's not psychiatric involvement with the prescribing of psychiatric medicines, that sometimes those aren't in the most ideal circumstances. And we'd just like to get those partnerships a little bit tighter between primary care and mental health care.
Let us know how the newspaper can help.
Okay, will do.
Let me ask you about the hospital level services. Do we have what we need there?
It seems to me that there's been a growing need for those services, crisis stabilization services, and that David Lawrence is trying to keep up with that demand, but we're needing to continue to grow in that regard. So that's a very exciting area that the board, the staff, and I have started to discuss is how can we develop more services to increase access to care for people in immediate need.
Now, Lee County has a mental health hospital up there, but Collier that it would appear to me as a layman to be somewhat of a gap.
Absolutely. And I'm trying to fully assess what those needs are at this point.
Okay.
But I believe that you're correct in that regard, and that it's something that we want to continue to address.
We should point out for our viewers who don't know that David Lawrence Center is a big deal. 300 employees.
Yes.
A budget of nearly $20 million.
Yes, yes.
And you touch the lives of maybe 40,000 people a year.
Absolutely,
Okay,
absolutely.
so
It has, and the other thing that I think sometimes gets lost in the translation of the numbers is that those are all unique individuals that have challenges and have opportunities, and not only those individuals, but every one of those individuals is part of a family.
Family members.
As part of a business
Exactly
environment, perhaps, that if they're doing well and doing better, they can do better at work, and it really is a massive snowballing effect for the community when individuals are cared for in the way that they need support.
Let me ask you, how much of the cases the work that David Lawrence does is related to drug abuse? And I'm going to include alcohol because that is a drug. We'll tend to forget that. But how much of the workload that you see starts there?
Yeah, that's in my understanding, because this is actually my second week at David Lawrence Center, so I'm still trying to completely drill into the numbers. But I believe that about 30% of what's being done from a treatment service standpoint is related to addictions issues, and 70% is related to mental health. And then of course there's individuals that have co-occurring illnesses.
Right.
Right.
Okay. Well, in terms of the community, David Lawrence is doing more community outreach and more community education, how everybody can partner and work on this together. Is that part of your agenda as well?
Absolutely. I really sincerely believe that partnership and collaboration and community involvement is critically important for us to. There's long been a stigma, and I know I actually saw Dave's show that he did with you,
yes,
where he talked about the stigma associated with mental health. I've often said that mental illness is the only illness that's being whispered about anymore. It used to be other conditions would be whispered about.
Okay.
Mental illness is something that really needs to get out in the forefront. It's no different than any other medical illness.
Scott Burgess, welcome to Naples. Good luck. We'll work with you.
Thank you
so
much.
We'll root for your success, too.
Thank you.
Next up, we have another guest who's originally from the Illinois-Chicago area, Craig Bouchard, talking about his best-selling book right after this.
Hi, I'm Tiffany McQuaid of McQuaid & Company Real Estate Services. If you're buying or selling a home, let McQuaid & Company give you the comprehensive edge in achieving your residential and investment goals. From outstanding multimedia marketing programs to sell your property, to deep knowledge of the region's marketplace to find your new home, our highly experienced McQuaid & Company team will provide you with maximum results with a personal touch. We call it real estate to the nth degree.
Since 1990, recognizing and providing resources for teachers to inspire students. Connecting parents and the community to schools so students can gain the life skills they need to succeed. With our new name, we are bringing our community together, investing in innovative practices and enriching the environment for student learning. Our story, our newspaper.